And now our third story out front. Unworkable, unpopular, and unaffordable. That's how Republican Senator John Barrasso describes the president's health care law. But tonight, he can no longer say it's unconstitutional. The Supreme Court decision today flies in the face of what Senator Barrasso has been vowing to do since January of last year, repeal and replace the health care law.
Nothing should come between you and your doctor. Not a government bureaucrat, not an insurance company bureaucrat, nothing. Republicans will fight to repeal this job-destroying law and replace it with patient-centered reforms.
What exactly are those reforms he's talking about? Senator Barrasso is out front tonight. Senator, good to see you. Appreciate it. I know you've been talking about repealing and replacing this health care law for quite some time. Obviously, you're going to vote in favor of the repeal. You would. I mean, you're in the Senate, but they're going to be repealing it in the House in a couple of weeks. But let me just ask you where you stand on some of the provisions that Americans love. You can't discriminate against people with pre-existing conditions. Young people can stay on their parents' plans until they're 26. There's subsidies for lower-income households. Small businesses get tax credits. Would you keep all those things?
You know, my wife is a breast cancer survivor. She's been through 3 operations, chemotherapy twice. I know how important it is for people with pre-existing conditions to be able to get coverage and to get care. And there are a lot of ways we can do it in a way that is actually more cost-effective than it happens through this health care bill. The same thing with those under the age of 26. You're talking about fewer than 1% of all people in this country are covered that way. So there are things that we can do to actually lower the cost of care and help everyone. Under this health care law, though, you look at the president, so many of his promises that have been broken. He said under the law that insurance premiums would drop $2,500 per family that first year. Instead, what we've seen is premiums have gone up $2,400 a family. This law, it was a bad law yesterday, and in spite of the Supreme Court's decision today, it's still a bad law tonight.
All right, so let me just a couple things you said there I want to clarify. First of all, you're saying that, yes, you would pay for it, but you would keep things like young people can stay on their parents' insurance, coverage for pre-existing conditions, right? That would be part of a good health care bill in your view.
Well, I think it is, and I said that on CNN 2 years ago, the day of the White House summit, where we were discussing this. I think someone from CNN asked me, what could we pass today that people agree on? And that was one of those things. So I think there's some benefits for that. But fundamentally, we have a health care law that gives people fewer choices and increased costs and fewer control of their own life and their own health care. And I think it's still a bad law and should be repealed and replaced.
Okay, so let's get to this issue of cost, because, you know, you raised something we've been talking a lot about. Premiums are going to rise. Estimates are 7.5% under this. That is still more than any raises Americans are getting. It's 4 times the rate of inflation. That's really bad. But, you know, this president tried to fight that. He went out to the doctors and said, I want to cut what you guys are getting. I don't want so many tests. And he got fought back by them, by Democrats, by Republicans. Nobody wanted to take the political heat for paying for it. Would you tell doctors, forget it, guys, stop with all those tests?
Well, as somebody who's practiced medicine for 25 years, I can tell you that doctors worry about the lawsuit abuse that exists out there, which caused them to order many expensive tests. It's called defensive medicine. It's when a doctor orders a test more to treat the doctor than the patient, because they don't want to miss that 1 in 1,000 or 1 in 10,000 cases that's going to end up for them to be in the courtroom rather than in the operating room.
Fair point, but they also order those tests, those machines.
Expensive tests.
Okay, that's true, but they also order those expensive test machines and put them in their office because they know they can get reimbursed for insurance for a lot of money by putting those tests through. And that's why doctors keep going in practices and ordering more of those machines. I mean, that's also been proved in study after study to be true.
Well, you know, I mean, it's an interesting concept about just how much money is wasted in health care that's not really being used to help the patient get better. But the physicians that I have worked with over the years, it is driven by the concern about getting sued. Defensive medicine is a huge part of the cost of care, and some physicians do put the machines to order these tests in their own offices for the convenience of the patient, but it is driven by the defensive medicine that's been practiced, and the president has essentially ignored this, refused to admit how much this contributes to the cost of care. The American people need health care reform, and the reason that they need it is because of the cost of care. That's what this whole thing was supposed to be about from the beginning, making sure patients could get the care they need from the doctor that they choose, not that the government chooses or some insurance company chooses, at lower cost. And this health care law has failed on all of those accounts.
Okay, but let's look at the biggest cost, things that account for costs in drug in America. You got hospitals. You've got these tests that come from doctors, and you've got prescription drugs. Obviously, a big part of that came from the prescription drug plan under George W. Bush. So are you going to go to those hospitals, to those doctors, to those drug companies and tell them, we're just not going to do this anymore? I mean, you know, we have to admit that the president did try. It was Democrats and Republicans both who were afraid to go ahead and fight the costs.
Well, I think that the president basically misled the American people. He said the negotiations would be covered on C-SPAN. Things would be all open. These were all closed-door negotiations. It was one party making all of the decisions. The bipartisan ideas were not accepted. The patient refused to listen to Republican ideas aimed at lowering the cost of care, bringing more competition into this, allowing people to buy insurance across state lines, giving individual incentives for people who take efforts to actually lower their cost of care by losing weight, by taking more control and prevention in their own lives. The president ignored item after item and came out with a one-size-fits-all, which really has driven up the cost of care faster, the reports show us, than if the law had never been passed in the first place.
Senator, thank you very much. We appreciate your time.